Love it, love it, love it. Okay, let's get the gears shifted into main topic of today's episode.
Yes.
Like I said, right hot off the presses, dropped early this morning from our friends over at Forbes. Maybe someday they'll be our friends. If I'm willing to cut a check, we can post one of my articles on there.
Wait a
That'd be
second. You're telling me they're not just giving all of these people an opportunity to write on their website?
That's right, little Billy. That's right.
That's what kills me. Is like I think we know the situation, but all these people who act like, Forbes reached out to me and they wanted me to publish on their site because I'm so successful. It's like, or you paid them so you could
Yeah.
publish your article on there.
They reached out to you. A salesperson reached out to you, just like a car salesman wants you to buy a new car.
Yeah.
Hey,
Yeah.
want to talk to you. All right, let's jump into this article that just came out from Forbes on CVS, Aetna, and the ACA Obamacare market. So I admittedly did not have time to go through this super in detail, but I did go through it a little bit. I was able to skim through it, and super, super interesting. So it's titled CVS Plans to Exit Obamacare in 2026, Impacting 1 million Aetna members. Wow. So written by Bruce Japson. Shout out to Bruce. Came out today at 6:30 a.m. Eastern Standard Time. So the article starts off by saying CVS Health plans to exit the individual health insurance business, also known as Obamacare, next year, leaving about 1 million Aetna members in 17 states looking for new coverage in 2026. The decision disclosed Thursday on a day when CVS reported nearly $1.8 billion in net income amid a financial turnaround comes as a relatively new management team works to get rising healthcare costs in its Aetna brand health insurance plans under control. Quote, the company decided to exit the individual exchange business where Aetna independently operates ACA plans for 2026. CVS said in a statement Thursday accompanying its first quarter earnings report regarding coverage its Aetna health insurance unit sells under the Affordable Care Act known as Obamacare. This decision is consistent with others taken this year to focus the company's portfolio, CVS said. The company is best able to serve members through its other health benefit solutions, which offer access to quality care, affordable health benefits, and exceptional service. The company will continue delivering superior service and support to its individual exchange members through 2025 and residual activities in 2026. So first reactions, Mr. Glenn Shelton.
This kind of reminds me of the Cigna situation, it seems like from a P&L standpoint, maybe at the top, they're looking at it like, hey, this is what's working best. This is what's not working. And they're trying to cut the fat. That was kind of my gut reaction as I'm listening and reading with you here. What's your initial reaction to this news?
Yeah, I think it's, clearly anytime a carrier decides to just cut bait and pull out of a market entirely,
yeah,
I think you're right. I think there's some similarities to the Cigna situation, but it's a little different. Like instead of selling off their business and getting some kind of return on their business, they're just pulling the plug and canceling everybody, which means it is not going well in such a degree that they're just like, we just want to be done. We don't want this business at all. We don't want anything back for it. We just want to pull the plug and get the noose around our neck off.
Yeah, I mean, I guess it is interesting from that perspective of like, was there no value to be had to try to offload this and actually sell this to someone else? Like, why wouldn't you think they would at least, or maybe they were attempting it and they didn't get anywhere. Maybe they've already been, on the back end of this, they've been trying to get a deal and it wasn't going anywhere. So they're just like, screw it, we're out.
Yeah. Let's keep reading because it might provide a little bit of
let's keep going.
Insight, especially this next part. Okay, so CVS's move to exit the individual insurance market comes as the Donald Trump White House and Republicans in Congress ponder cuts to health insurance benefits to pay for tax cuts for wealthy Americans. Okay, is that true? Is that propaganda? I mean,
it's on Forbes.
Come on, Forbes. Come
true.
on. Oh, give me a break. Trump has never been a fan of Obamacare, which he tried and failed several times to repeal in his first term. And his administration has already made moves to cut spending on such health benefits, already slashing what the federal government spends on navigators that help people sign up for Obamacare coverage. So basically, subsidies getting cut from the government right now is probably a big contributor to this. Because let's face it, right? Like ACA business is really, really heavily dependent on subsidies. You know, there are people that are paying for their premiums outright, but it's probably a small minority of people. And premiums without subsidies on ACA are freaking enormous. You and I both know that.
Oh, yeah. Well, we also talked about on the show, you know, the no-call ACA lead situation, right? And this agent mentality over the years of essentially just reporting $0 income for everybody they come across, which has only made this whole situation that much worse, right?
Thanks, kings and queens out there.
I thought you were going to say some names for a second. I was like, oh, here we go.
I'm behaving today. I'm behaving.
That's shocking.
All right. So article continues to say, meanwhile, it remains unclear whether subsidies Americans use to buy individual coverage will remain once Congress has passed its budget. So some things still up in the air. Enhanced tax credits to buy Obamacare that were signed into law by former President Joe Biden ran out at the end of this year, and it remains unclear whether a Congress led by Republicans will extend them. Such tax credits contributed to record Obamacare enrollment for this year of $24 million. So largely provided by subsidies from the government. You know, like it's easier to get a plan, easier to qualify for a subsidy. I mean, there have been people over the past couple of years that are making six-figure incomes that are getting subsidies on their plans, which I found kind of crazy.
Do you remember that story I told you about the manager at one of the call centers I work with, where this person, and this is not tax advice, this is, if anything, this is what not to do. This person had the belief that if they just never filed taxes, they would never be found by the system, which from my understanding, this has already come back to bite them.
That's a crazy theory.
It's an insane theory. Like,
dude,
you got a social security number, so they know you're out there, right? Like,
you're not an illegal immigrant, bro. Broseph.
Oh my gosh. But you know, so I'm sure there's probably a lot of people out there who aren't paying taxes and they're getting subsidies, right? There's gotta be.
I have no doubt about it.
Yeah.
All right, well, let's read a little bit more of this, and then we can kind of get into a little bit more reactions. CVS has about 1 million people in its Aetna brand individual health insurance plans spread across 17 states. Those Aetna health plan members will have to purchase new coverage on the ACA's exchange this fall when insurers unveil their benefits for 2026. So if for those of you that haven't figured this out yet, this is happening. This is not like speculation. This is done. CVS
is there anything from CVS directly about this?
Yeah, we've read quotes already. We can go back to them.
But has CVS published anything directly?
Here you go.
Company decided to exit. Yeah, quote. CVS said in a statement Thursday morning. Yep, there it is. I was trying to play devil's advocate and say maybe some of this is a little more speculative, but yeah, I mean, it definitely seems like they're pulling out. It's done.
This article is being written reacting to their public announcement of their decision
this morning.
This isn't speculation. Yeah. This is happening. So for those of you that are in the ACA market, this affects us for sure. Any Aetna business you have, you're going to have to rewrite. Period. Point blank. Come open enrollment. CVS moved to extend. Let's see. Yeah, we kind of already went through all this already.
It seems like the reasoning behind the move is what's being speculated on more. But it's definitely yeah.
One more thing I wanted to I want to just go over this next few parts here because I think this is relevant. CVS Aetna Health Insurance Unit is not a big player in Obamacare. like some of its rivals, and individual coverage is a fraction of the total medical membership CVS reported as of March 31st, 2025 of 27.1 million, which the company said remained relatively consistent compared with December 31st, 2024, reflecting membership declines in the individual exchange and Medicare product lines. So basically, it's not a big part of their business compared to their Medicare business, their group health business, stuff like that, which I have seen as well. I've seen in some markets they've been kind of competitive, but like overall, I don't think they've been lighting the world on fire in the ACA market the last few years. CVS and rival operators of health insurance plans, particularly Medicare Advantage benefits for seniors, have been hit hard in the last year with higher costs, Inflation Reduction Act. Let's see. I will end this in just a second. There's just a couple more spots I want to hit.
No, keep going.
Medicare Advantage plans contract with the federal government. Okay, we know that. But CVS said it is getting a better handle of cost trends. In its first quarter, the company's medical benefit ratio, which is the percentage of premium revenue that goes toward medical costs, decreased in the first quarter to 87.3% from 90.4% in the prior year. The company attributed the better performance in part due to improved underlying performance in Medicare, including the impact of improved Medicare Advantage star ratings for 2025 payment year. Essentially, what they're saying is
Medicare's making so much green. Why even mess around in the ACA market?
Right. We want to focus on what's working and we want to cut distractions. That's what I'm getting out of this. CVS, which also operates the nation's largest retail drugstore chain, one of the nation's largest pharmacy benefit manager companies known as Caremark, said total revenues rose from 7% to $94.6 billion in the first quarter compared to $88.4 billion in a year ago period. First quarter net income was up to $1.77 billion or $1.41 per share compared to $1.11 billion or 88 cents a share a year ago in the first quarter. So yeah, I mean, I think this is pretty straightforward. They were not making the same type of profitability on ACA that they were on the Medicare market.
Yeah.
They weren't competing in a big way in the ACA market. And it was probably pulling more resources and attention than anything that they want to allocate towards the Medicare market. It makes total sense. And, with kind of this uncertainty about where the direction was going to be going for the future of ACA and funding of it and everything like that, it'll be interesting to kind of see what happens.